Hey gentlemen, quick question. When things heat up, how long do you actually spend on her chest? 30 seconds? A minute? Most guys treat the breasts like an appetizer before the main course. That's a missed opportunity. Breasts are richly innervated, emotionally meaningful for many women, and when you approach them with consent, patience, and the right technique, they can be a powerful source of arousal. And yes, for some women, even orgasm. Today, I'm giving you a clear, respectful, science-aware playbook you can use tonight. Practical steps, what's happening in her body, how it affects her emotionally, and exactly what to do. I'm Dr. Jocelyn Carter, urologist, 5 years working in men's health and sexual medicine, and I talk straight, no nonsense, about how to improve intimacy so both of you feel closer and more confident. Before we jump in, do me a favor, hit like and tell me where you're watching from in the comments. I love seeing the countries and cities pop up. Also subscribe if you want weekly practical advice that actually works. Let's clear one big myth. Touching breasts is not a one-size-fits-all activity, and it's absolutely not something you rush. The myth is more force, more attention equals better. The truth? Slow, intentional, responsive touch wins every time. Why? Because sensitivity, arousal, and comfort are all dynamic. They unfold. If you push too fast or use a rough mechanical approach, you'll likely cause tension, reduce pleasure, and risk crossing boundaries. So if you want to be memorable, be present, not showy. A quick note about me, I'm Dr. Jocelyn Carter. I've spent the last 5 years helping men treat problems like erectile difficulty, premature climax, and confidence in intimacy. And what I hear again and again is not a lack of interest, but a lack of knowledge and courage to learn. This video is designed to fix that. The techniques I share are practical, respectful, and rooted in how the nervous system and body actually respond, and I'll tell you the exact words to use so consent and comfort come first. Tip 1. Set the stage with consent and curiosity. Why it matters, a 5-second question changes everything. What to say, do, practical. Before you dive in, ask one simple, non-threatening question. Do you like breast touch? Light, firmer, or not at all? Use an easy check-in code while touching. Green equals more, yellow equals gentler, red equals stop. Keep your tone soft and curious. Biology. What happens in the body? Asking and getting a yes lowers sympathetic defensive reflexes. That helps the parasympathetic system, the rest and receive mode, take over, increasing pelvic blood flow and making touch feel pleasurable instead of startling. Emotional effect. Asking shows respect and removes shame or guessing. It builds trust, and trust opens the door to deeper pleasure. Practical day-to-day. Try this line once this week. Keep it simple. It beats assuming and prevents awkward moments. Tip 2. Slow way down and start wide. Why it matters? Speed clams up nerves. Slow strokes relax them. What to do? Don't jump from neutral to peak. Begin outside in, slow palms across the upper chest, gentle strokes along the collarbone, light kisses along the neck. Use broad movements, warm palms, not poking fingers. If you use a lubricant, choose an unscented, body-safe one for gliding. Biology. The skin has different touch receptors. Slow, steady strokes activate C-tactile fibers that are tuned to gentle, pleasant touch. That tells the nervous system it's safe to relax, blood flow increases, and tissues become more receptive. Emotional effect. Slow builds anticipation and reduces the chance of ticklishness or overwhelm. It signals you're deliberate and caring. Practical. Spend at least a few minutes here. Think of it as the soft tuning phase. You're warming her up for bigger sensations later. Tip 3, hold with intention. Cradle, don't poke. Why it matters? Unsupported movement can feel uncomfortable. Support feels confident. What to do? Use your whole hand to support each breast, palm under, fingers around the sides, alternate gentle compressions with moments of stillness. Cradle and let the tissue rest in your hand. Avoid pinching or quick jerks. Biology. Supporting tissue reduces strain on ligaments and prevents painful tugging, which would activate protective reflexes and blunt sensation. Stillness and pressure can increase localized circulation and let nerve endings register pleasure more clearly. Emotional effect. A confident, caring hold communicates desire without roughness. It creates safety and increases emotional closeness. Practical, keep your nails trimmed. If you're in a hurry, pause. A calm hold for 10 to 20 seconds often says more than a minute of clumsy motion. Tip 4, give the areola real attention. Why it matters. The areola is densely innervated, not just the nipple. What to do? Use 1 or 2 fingers to trace slow circles around the areola, sometimes spiraling towards and away from the nipple. Always support the breast with your other hand so the tissue isn't pulled. Keep pressure moderate and let your touch be measured. Biology. The areola and surrounding tissues contain many sensory nerve endings. Stimulating them creates a broader pattern of feedback to the brain than nipple-only focus. That can be more comfortable and more effective. Emotional effect. Thoughtful areola play feels intimate, not mechanical. It signals that you notice detail and care about her experience. Practical. If she leans in or breathes deeper, that's a green sign. If she tenses, ease off. Tip 5. Treat the nipple like a dimmer, not a switch. Why it matters? Too abrupt and you hit pain or numbness. Slow ramping brings pleasure. What to do? Start feather light, soft strokes, warm breath, gentle fingertips. If she asks for more, try a slow roll between thumb and forefinger or a light press and release. Avoid sudden tugs or aggressive suction unless explicitly requested. A drop of lube can reduce friction on sensitive skin. Biology. Nipple tissue is sensitive and can respond dramatically to small changes. Gradual increases recruit more receptors and often lead to a sustained, pleasant response rather than sharp pain. Emotional effect. Moving slowly tells her you respect her comfort and are paying attention to cues. That increases pleasure and trust. Practical. If she asks for firmer stimulation, increase pressure gradually and keep checking in. Tip 6. Use your mouth thoughtfully. Warm breath, gentle suction. Why it matters. Mouth and breath deliver contrast and warmth that fingertips can't. What to do. Begin with warm breath across the areola, then gentle licks around the circle. Try light, soft suction, not clamp-like. If she asks for teeth play or harder nibbling, have a clear signal beforehand. If you're experimenting, test pressure on your arm first so you know how light is light. Biology. Oral warmth increases localized blood flow and produces a different pattern of sensory input. Gentle suction changes pressure across the tissue and can feel deeply satisfying because it's a multi-sensory stimulus, temperature plus pressure plus texture. Emotional effect. Mouth play can feel intensely intimate. Done right, it deepens connection. Done without consent or care, it can feel invasive. So keep communication clear. Practical, pay attention to breathing and micro movements. They'll tell you if she likes it. Tip 7, let words and breath amplify sensation. Why it matters. Your tone and breath change her nervous system more than you expect. What to do? Keep your voice low and unhurried. Offer a short, sincere compliment. You smell incredible, or I love the way you're breathing. Ask tiny yes, no questions. Like softer, yes, match her breathing. Longer exhales calm both of you. Use short verbal cues to guide pressure and pace. Biology. Calm, slow breathing increases vagal tone and reduces stress hormones. That shift makes touch register as pleasure rather than threat. Your voice, lower pitch, and steady cadence also signals safety to the brain. Emotional effect, words knit emotional closeness. A single sentence that affirms her can unlock deeper relaxation and more openness. Practical, keep words short and supportive. Less is often more when sensations are building. Tip 8, blend breast play with external clitoral stimulation. Why it matters. For many women, the most reliable route to orgasm includes clitoral stimulation. Pairing it with breast play amplifies everything. What to do? If she enjoys external stimulation, keep one hand or a small vibrator on steady clitoral contact while your mouth or other hand focuses on the breast. Keep tempo consistent. Change only one thing at a time so her brain can lock onto what feels best. Communicate. Do you want me to keep this steady? Biology. The clitoris has a very high concentration of sensory nerve endings. simultaneous stimulation of the chest, which raises oxytocin and arousal, and the clitoris, direct sensory drive, can create a stacked effect that some women find intensely powerful, sometimes producing a breast-related orgasm, sometimes a blended one. Emotional effect. Combining touch shows coordination and intent. It reads as purposeful pleasure-giving, not scattershot groping. Practical. If you use a vibrator, start on the lowest setting and keep it steady. If you're using fingers, maintain a reliable rhythm. Small, consistent motions beat frantic changes. Tip 9. Use temperature and tools carefully, always with an enthusiastic yes. Why it matters. Contrast heightens sensation, if it's welcome, and toys can add new dimensions, but both require care. What to do? A cool fingertip, a warmed palm, or a mild breath of cold air can add contrast. If you try toys, pick quality, start low, and set a time limit for the first few uses. Avoid anything sharp and stop immediately if there's pain, blanching, or numbness. Biology. Gentle temperature shifts alter receptor activation and blood flow. Light coolness can create sharp contrast that the brain interprets as heightened sensation. Very strong changes or poor quality suction can cause tissue damage or nerve irritation. Emotional effect. When used with consent, these tools can be playful and novel. Without consent, they feel like a violation. Practical. Check for allergies, skin issues, pregnancy sensitivity, bleeding disorders, or neuropathy first. Start with 1 or 2 brief trials and be ready to stop. Moves that change everything. Warm your hands first. Cold hands trigger guard responses. Keep nails short and smooth. No scratching. Support breast tissue during motion so nothing tugs on ligaments. Use a neutral, unscented lube for friction-sensitive areas. Practice aftercare decompression. When you finish, pause, hold her, and let everything settle. Many women say the quiet pause is the most satisfying part. If breast touch is painful or consistently uncomfortable, encourage a medical check. Sometimes hormones, skin conditions, or post-surgical sensitivity are involved. Ask and get consent. Start wide and slow and hold with intention. Give areola attention. Dim the nipple like a dial. Use your mouth thoughtfully. Use words and breath. Pair breasts with clitoral/external stimulation. Introduce temperature and toys only with enthusiastic yes. Here's a practical plan you can use this week. No grand gestures, just small steps. Tonight, before anything, ask the simple question about breast touch. Keep it casual. Practice the slow, wide warm-up. Spend 3 to 5 minutes just with palms and collarbone strokes. Notice if she relaxes. Try the areola circles. One hand supports, the other traces slow circles. Watch breathing and micro movement. If she's into it, add a steady clitoral touch while you do the above. Keep the rhythm consistent. After, pause together. Don't rush to check a phone or roll away. The decompression matters. If you're someone who worries about stamina or blood flow, remember, sexual technique and sexual health go hand in hand. Things like sleep, exercise, reducing stress, and a balanced diet matter. Some men use natural supports like L-citrulline, found in watermelon extract, or broader herbal blends. If that's something you're considering, talk to your clinician about interactions and safety first. Look, most men weren't taught this stuff. You don't have to be perfect. You have to be present. The single biggest switch is attention. If you ask, go slow, and actually pay attention to what she communicates, verbally and physically, you'll be better than most. Many men in their 40s, 50s, and beyond tell me intimacy becomes richer as they learn the art of presence. Age isn't a limit. It's an advantage if you use the wisdom that comes with experience. Here's the bottom line. Small changes to how you touch, ask, and pay attention will create huge changes in comfort, pleasure, and confidence. Breast play doesn't have to be an awkward afterthought. It can be a deeply connected part of your sexual life that both of you enjoy. If this helped, do me a favor. Like this video, subscribe, and leave a comment telling me where you're watching from and one thing you learned. If you want, I'll make a follow-up video with suggested positions and short demo cues, text-only clinical, to help you practice with clarity. Remember, age is not the end of vitality. Small intentional changes bring comfort, freedom, and confidence. You can learn this, you can get better, and she will notice the difference. I'm Dr. Jocelyn Carter. Take care of your health, take care of your connection, and I'll see you in the next one.